Okay, we seem to be live. So hi everyone, thank you for joining us today. My name is Vidya Ledsham. I'm a volunteer with Fertility Matters for a couple of years now, and I'm so excited to moderate today's session with Dr. Kathy Wise and Dr. Kim Daniel from Kelowna Regional Fertility Centre. Today we're going to be talking about freezing our eggs. So the topic is called, Should I Freeze My Eggs? And we're very thankful that this session is brought to you with the generous support of Ferring Pharmaceuticals. So Dr. Kathy Wise and Dr. Kim Daniel, welcome. Thank you so much for joining us today.
Thanks for having us, Vidya.
So, let's get right started. Do we want to start by just talking about what egg freezing is and giving some basic information, and then we'll launch into questions. And for everyone watching today, if you have any questions, please feel free to just write them in the comments on Facebook, and hopefully we'll be able to get to all of them. So take it away.
Thanks, Vidya. So I'm Dr. Wise, and my colleague in the other frame there is Dr. Daniel, and it's our pleasure to chat with everyone today. This is a really unique opportunity and very cool platform that I've never participated in, so I'm excited and I look forward to questions. I think I just wanted to state initially sort of why we're having this conversation today. We know that egg freezing is a hot topic, if you want to call it that. And we're getting more and more questions about it, which is wonderful. But the reason we're getting questions is because we're finding that it's quite common for a person to delay childbearing for various reasons. It might be social, personal, financial reasons, very good reasons nonetheless. And so they are looking for options, because we know that one of the biggest impacts on a person's fertility, on a woman's fertility, is advancing age. So egg freezing, in a nutshell, is where we use hormone stimulation, specifically follicle stimulating hormone, to stimulate the ovaries to produce multiple eggs in one treatment cycle. And we then go in and extract those eggs from the ovaries and we freeze them. And those frozen eggs can then be used at a later date, if necessary, to potentially help that person to conceive. Vidya, I can't hear.
I think you're on mute, Vidya.
I don't know how that happened. Sorry. So, technology. Whoops. That's really great. Thank you for that. Thank you for that background. So who makes a good candidate for egg freezing?
So any person with reasonable ovarian reserve is a candidate to go ahead with egg freezing. The choice really is up to the individual. The younger you are, the more likely you are to have high ovarian reserve, and therefore when you do freeze eggs, you're going to get better numbers of eggs from that cycle, as well as higher quality eggs at that time. And so ideally, women between the ages of 25 and 35 will wind up having the best results from this. However, women over 35 certainly can consider it. And if they're looking at it as an option, patients could contact a local fertility clinic, have a look at their ovarian reserve, and get a fairly accurate idea of what sort of egg numbers they would likely produce if they went through a stimulation cycle or egg freeze cycle.
And I'll just add to that, you guys, that we are often approached by women who either do know they want to have children at some point, but perhaps don't have a partner and would prefer to wait until they have a partner. Might be someone who knows that they're about to embark in something like a long educational pursuit or a career move where they feel they can't realistically consider having a child for another few years. We also are in situations where women want to preserve their eggs for other reasons. They might be going through medical treatment that might affect their future fertility. So these are all the reasons that you might consider doing an egg-free cycle.
That's interesting. So we talked about who makes a good candidate. Are there any criteria that would make someone a less than ideal candidate for egg freezing?
I would say, Vidya, that someone who is 40 and over probably is not an ideal candidate for freezing eggs. The odds of a successful future pregnancy from those eggs and also expectations for a lower number of eggs would make her less than ideal. And as Dr. Daniel indicated, it also depends on your natural egg reserve, what we call ovarian reserve. So that is how many eggs you have remaining in your ovaries, which also would predict how many eggs we could develop and then extract for you. Some women with a very, very low ovarian reserve may not be ideal candidates for egg freezing. That's a tricky one. It depends on the situation, but those are the ones that come to mind.
So, you know, everyone in the world of fertility knows about age being a potential limiting factor. If someone was over 40 and, you know, was thinking then about freezing their eggs, is it basically a no-go, or is there additional testing that can be done to see if, you know, it's worthwhile or not?
So if we have a patient who is around the age of 40 and possibly has decreased ovarian reserve or lower egg numbers than ideal, there is blood work that we can do to give us a fairly reasonable estimate of how many eggs are left in reserve, as well as an ultrasound that we can do where we count the number of small follicles in the ovary, and it gives us a good idea of what we can expect. And certainly there is a hereditary predisposition to number of eggs, and so sometimes women who are in that age group will have above average or a higher number of eggs than we would anticipate, and so they may be a better candidate than other patients to have that done. So, you know, if we do that assessment, we give you an idea of the number of eggs that might be produced from one cycle. Then there is actually calculators that are available that will tell us what your chances of having a successful pregnancy from an egg-freeze cycle are based on your chronological age, as well as the number of eggs that we anticipate you would be able to produce from one cycle. So we could tailor the conversation to a specific patient to give them an idea of what to expect.
Okay. So basically, like, don't consider yourself out of options at any point. It's worth asking the questions to a doctor.
Yeah, definitely.
Worth asking the question and at least getting all the information specifically for yourself.
Wonderful. So can you walk us through the process of egg freezing? What does it look like? How long does it take? What's required?
So it starts with the consultation, as we already alluded to, so that we can take your history, do a physical examination, and just make sure that it is safe and reasonable for you to go ahead. The process itself is about 2 weeks, and it involves those hormone injections I was alluding to. So these are small subcutaneous hormone injections that anybody can be taught to give themselves. Typically it's twice a day, and it's timed to a menstrual cycle. So it starts at the beginning of a menstrual cycle and continues on, it depends, but anywhere from 9 all the way up to 14 days, average being somewhere around 11 days of stimulation. And in that time, the woman undergoes some ultrasounds and blood work to just assess her progress, perhaps make little adjustments to the medication, and then most importantly, understand when the egg follicles have reached their ideal size so that we can then arrange the egg retrieval. The egg retrieval is the actual extraction of the eggs, and that is done with the help of vaginal ultrasound guidance so that you can see the ovary and the follicles, which are little water pockets containing the eggs. And they can pass a very fine needle with the help of the ultrasound through the upper vagina and directly into the egg to gently suction the eggs out of their water pockets. So that is a little bit procedural. In Canada, we do that with the help of intravenous pain medication and support. We don't do it under general anesthesia, and it's certainly not a surgery per se. And then once we have the eggs, that's when the eggs are then vitrified. So vitrification is the medical terminology for the type of freezing that we do to cryopreserve those eggs long-term for that individual.
So the process sounds very similar to, you know, going through the IVF process to create embryos, except it kind of stops short at the insemination part. Is that right?
It is, Vidya, yeah, very much so. So it is essentially the first part of an IVF cycle. And then if a person decides to use those eggs down the road, then the eggs can be thawed, subsequently fertilized with sperm so that embryos are created and then can be used. So you're exactly right. It is the first part of an in vitro fertilization cycle. Great.
So this is me knowing maybe too much about IVF, but also not enough at the same time. But when the eggs are thawed and used to create embryos, can those embryos be refrozen and used later as well? Or does it have to happen as a fresh cycle at that point?
So essentially when the eggs are thawed and then fertilized, the remainder of the cycle would be similar to any IVF cycle where they could be fertilized and you could have either a fresh transfer with an embryo, or you could freeze the embryos and go back later for a frozen embryo transfer. So the second part of it is also very similar to an IVF cycle.
So it's not like chicken where you can't freeze it again.
It's not like chicken.
Okay, great.
Can you really not do that with chicken?
You're not supposed to freeze meat twice, is my understanding. Okay, so that's really interesting about the process. What are we talking about in terms of cost?
Oh, great question. I'm going to tell you what our costs are typically in BC, but I expect that there's going to be a little bit of inter-provincial variability here, so I would encourage anybody who's listening from a different province from BC, where Dr. Daniel and I are, to maybe look into what sort of local costs are. But we anticipate that this process would cost somewhere around $10,000 to $12,000 for the treatment cycle. That includes all of the medications and the procedures that we described.
Okay. So it's interesting because we talked about what the ideal age is, which is, you know, people are typically within the age range of 25 to 35 years old when they're looking to freeze their eggs. And that's an investment at that age, right?
It's very significant, and it's part of our frustration, I think, as specialists in this field and caregivers, where we want to see access to this treatment broadened, and it's a huge limitation. There's not that many, I'll say, less than 30-year-old patients out there who really have that kind of disposable income. So it really is a frustration because they may have asked about it, they may have a strong desire to freeze eggs, and sometimes finances are the biggest barrier.
Mm-hmm. I know you practice in BC, so it might be different in other provinces as well, but is there any kind of funding or anything like that available? For instance, if there are health reasons that you're looking to freeze your eggs, is there any kind of funding that's available that you know of?
So there are some nonprofit agencies that can be applied to for funding for patients for medical reasons, most commonly around cancer treatment. So patients who have a diagnosis and are anticipating chemotherapy that could impact their future fertility. There is compassionate funding for that for most patients. As far as other funding, it's generally not covered by MSP, and so there are some different employers who do offer coverage for fertility treatments and extended benefit plans that often will offer coverage for medications. And medications are somewhere around half of the cost of an IVF cycle, so certainly if an individual has coverage for medications or even 80% coverage for medications, that will significantly reduce their costs and their access.
Absolutely. Does egg freezing hurt?
Yes, it can be uncomfortable. To be truthful, an uncomfortable process. It is still a little needle poke through the upper wall of the vagina, which remarkably is a little bit less sensitive, less tender than the ovary. So a woman's ovary is a potentially sensitive spot. That's why that pain medication is really important. And of course, a skilled physician who knows how to quickly access the eggs with minimal discomfort to the ovary. But I would say feedback from my patients and my experience over the years, not just with egg freezing, but with in vitro fertilization in general, is good. Most women tolerate it very well, and it is quite a short procedure, which is good news. But yes, you can anticipate a little bit of discomfort from the actual egg retrieval.
I think I can say from the patient side of things, and I am lucky enough to have PCOS and I make tons of eggs during an IVF procedure, is that it kind of feels like there are marbles in your ovaries. So when like very close to the egg retrieval date, it just feels like you're carrying around a little bit of extra weight, and you unfortunately get to look pregnant before you get to be pregnant. But I agree, it's uncomfortable, but it's not unbearable in any way.
And I agree exactly with what Dr. Wise said. I was just going to add that I think most patients do better in an IVF cycle than they think they will. Usually patients are concerned because maybe they didn't feel well on the birth control pill, or they've taken other hormone therapies before and they had side effects. But overall, women tend to do quite well through IVF cycles, mostly describing just bits of fatigue and definitely a sensation of being bloated or your belly being full. But overall, not a lot of PMS and not a lot of, terrible hormonal symptoms. And then at the time of retrieval, anticipating that it's going to be uncomfortable, but when they come back and we ask them how things went, oftentimes they say, oh, I think it was better than I thought it was going to be,
Yeah, definitely. And then I guess putting it into perspective, it's not even a full month's length of time, right? Like you're taking the drugs for how many days, and then like what does the typical cycle look like in terms of time?
Yeah, it is the 2 weeks that we were talking about earlier, Vidya. So that's the time when you're doing those hormone injections and you are actually growing the egg follicles. And in fact, the first week of that, I would say most women don't notice much physical change at all. It's maybe the second week when those follicles are getting bigger and the ovaries are enlarging and they're heavier. I love your marbles analogy. My patient today told me she thought she had developed new organs in her pelvis because she could suddenly feel her ovaries. So that's when you might feel it. And then the next thing you know, you're having your egg retrieval and your body is starting to recover. And it does take realistically a few days to a week to start to feel like your pelvis and your body is coming back to normal.
Mm-hmm. Wonderful. Let's talk success rates. How do you even go about calculating that, and what do they look like?
That's a tricky one, and it is also in a state of evolution as our technologies improve. So once upon a time when I started doing these treatment cycles, egg freezing was not a good option for women. We were using slow freezing methods at that time, and the survival rate of a little egg cell, a fragile egg cell was very poor, and the chances of a live birth rate was very low. But now with vitrification, everything has changed. And so the technologies have improved a great deal. And of course, the overall chances of having a successful live birth at a later date with your frozen eggs depends on your age when you froze your eggs and how many you have. And so we are lucky enough to have access to some calculation models that we can put in a patient's age and the number of eggs and get a sense of the probability of a future live birth or the probability of more than one future live birth. That calculation tool is actually available through our colleagues at Olive Fertility. So where Dr. Daniel and I work is in the interior of BC. We don't have an IVF lab here, so our patients do travel down to Vancouver, specifically to Olive Fertility for their egg retrieval and their egg freezing. And on their website, if you go under their egg freezing section, you will see a little calculator where you could put in your age and click the button, and it'll give you a nice little printout to tell you what are the odds of a future live birth. I'll give you an idea because I went in just to have something to be able to speak about today. So if you are a 35-year-old woman and you are lucky enough to cryopreserve or freeze 10 eggs, your chances of at least one future live birth is estimated at about 45.6%. A very specific number. If you increase that to 20 eggs, all of a sudden your probabilities are up to 72.6%. So quite a profound difference there.
And that's for one live birth from the 20 eggs.
That's right. Yeah.
Okay. Okay. How many eggs can you expect to retrieve in one cycle?
That's highly dependent on each individual. So, you know, we can look at the average for any given age, but overall we would take into account what a patient's anti-Mullerian hormone is. So looking at their ovarian reserve as well as an ultrasound to look at their antral follicles, and then give them an idea of how many eggs we'd anticipate from any given cycle. So it can vary anywhere from, you know, 5 to 20, right? So it just depends on the individual and what their ovaries have as far as number of eggs.
And I guess, is there like an ideal number or range of eggs that you aim to retrieve in a retrieval cycle?
Well, certainly for an egg freeze cycle, the more the better, up to a point. We aim not to produce more than 20 eggs in one cycle, because if we overdo it too much, then there's a potential for patients to become overstimulated and potentially develop hyperstimulation syndrome.
And is there also, like, this is speaking from my own experience as well, I guess if you're producing so many eggs, there's potentially an egg quality issue as well.
Yeah, true. We do sometimes see that more is not better. Some women with polycystic ovarian syndrome can produce a remarkable number of eggs in one treatment cycle, sometimes 30 or more. But there's often a percentage of those eggs that are either immature and not able to freeze or lower quality. So that's true. I usually tell my patients that a fairly average number of eggs during an egg freeze cycle is somewhere around 10. That's not unusual. Some women, of course, are capable of making more, and others biologically can make less. That doesn't mean they shouldn't do the cycle. That's obviously still a very personal choice. And some women, if they have fewer eggs, and particularly if we do a little calculation and say, okay, with your results, here is what we expect is a realistic expectation for a future live birth, they may choose to do another cycle. So they may choose to do another round of stimulation to get some more eggs to cryopreserve and add to the bank, as it were.
So I guess, like, depending on how many eggs you produce, like, do you ever recommend having more than one egg freezing cycle for a patient?
Yes, yeah, definitely. I recommend is a bit of a tougher word. Certainly we discuss it, and it very much depends on the ability of that patient to do a second freeze, both financially and physically. And what her experience was like the first time. But if she feels that her chances of having a future live birth are lower than what she would like, then there is definitely the option to do a second cycle.
Okay. Would those ever be like back to back, or would you wait in between cycles, or? Is it just individualized?
You can do them as close together as a patient desires. You can do them back to back.
Okay. As science advances, is there any advantage to kind of waiting for technology to improve, or are you better off to act sooner rather than later if you're kind of on the edge and not sure?
My counsel would definitely be to act sooner rather than later. Generally speaking, for eggs, time does not work in your favor, despite technological advancement. And technology does improve. There's no question. We've seen tremendous advancement in the last decade. But when you are 34, you can't wait a decade for that advancement, and the time to make that decision is here and now. So I would say that there isn't a tremendous advantage to waiting. The amount of time that it would realistically take for us to see really big changes in this technology.
So just a question about going back to egg quality really quickly. I guess one of the challenges with egg freezing is that there's no way to know if the quality of egg is good or less optimal. Is that correct?
Yeah, that is one of the challenges with egg freezing, and that's why the live birth rates vary slightly from live birth rates with IVF cycles, because when you do an egg freeze cycle, you don't know how many of those eggs are going to fertilize, and you don't know how many of those eggs are going to grow to day 5 or 6. So even though you know how many mature eggs are there, you don't actually have that definitive number of what the outcome of that IVF cycle is going to be. And so you have to take into account that there's going to be some eggs that don't fertilize, and then some eggs that don't grow, so they're not going to be able to be transferred later as embryos.
So if you're thinking about freezing your eggs and you might not be there yet, is there anything that can be done now to help improve egg quality for when you are ready to take that step?
Well, that's a great question too, Vidya. I think a lot of it would be common sense recommendations. So there isn't anything that really fundamentally makes our eggs better. Our eggs are very genetically predisposed to an aging process that we can't avoid. So, you know, we can't sort of emphasize enough how important time is in this decision making. Nonetheless, there are lifestyle choices that can definitely impact eggs and improve our chances of having healthy eggs when we do go through an egg freeze cycle. So maintaining a good, healthy diet, clean eating, trying to avoid too much processed food, too much sugar, too much of anything, I think.
Too much of anything good.
Trying to minimize alcohol and caffeine consumption, not eliminate, but definitely that there is a balance point there of minimizing not smoking. There is very clear evidence that cigarette smoking in particular is not good for eggs. It will age them prematurely. And for anybody who is a smoker, quitting smoking is very powerful as well, because we see those negative effects start to reverse. So it's not a permanent change. So there's a case to be made for trying to quit smoking, for example, before you do an egg freeze cycle. Staying active, getting regular exercises, trying to reduce stress in our lives in a realistic way. Life is stressful. There's always one stress or another, but doing things that are good for you as an individual to reduce your stress can be very valuable, and just trying to maintain a healthy weight. And I think just those common sense recommendations really do have some impact on the quality of our eggs.
That's great. Thank you so much for that advice. Just to close off, do you have any parting words or advice for someone who is considering freezing their eggs but hasn't made a decision yet?
I was just going to say, I think if you're considering it and you want the information, then to make an appointment at your local fertility clinic to just look at the numbers for yourself. Then you'll be able to make an educated decision about what you can anticipate for number of eggs, the chances of a live birth from those eggs, and talk a little bit more about what the process will entail specifically for you. At least get the information and then you can make an informed choice.
Yeah, I agree. I think if you're even thinking about it, come on in and talk to us, or talk to somebody in your own community who understands egg freezing and can really educate you. And the younger you are, the more likely you are to have more eggs. The more eggs you have, the better your future chances of a success. So I think that's just an important message that we sometimes don't talk about often enough.
Great. Well, thank you so much for chatting with us today, Dr. Wise and Dr. Daniel. This was incredibly informative. I hope everyone listening and watching right now also found this really helpful. Again, thank you to Ferring Pharmaceuticals for sponsoring this event, and also to Kelowna Regional Fertility Centre for offering your doctors to us to chat about this important topic. So as you know, Fertility Matters is a not-for-profit organization. We run these Facebook Lives. We try to run them every week, but we try to run them every week. It doesn't always happen because of scheduling conflicts, but we do our best. If you found this Facebook Live or any other of the Facebook Lives that we've done helpful, we really hope that you can consider going to our Facebook page and clicking on the donate button. Every dollar counts, and we really appreciate everyone's support. Thank you so much again for joining us, Dr. Daniel and Dr. Wise, and I hope everyone has a good day.
Thanks, Vidya. Our pleasure.
Thank you very much.
Bye.
Take care.